I welcome you to AFRH 2024, the 14th International Conference.
And I'm so enthusiastic and happy that having attended several AFRH meetings on a yearly basis that I could afford, the number of attendees has increased and the number of clinics have also increased.
This year's conference has been a very memorable one. It has been packed filled with a lot of activities, right from the conception phase, from the planning, to now the execution.
By the year 2050, there will be 400 million Nigerians. We can't have the same kind of healthcare system that we're struggling with today. We need to put some improvements in it.
We don't know how to measure volumes or temperature or altitude, but we develop tools to help us do that. And AI is just a very simple way.
We must, however, foster collaboration across multiple sectors. We need medical collaboration between our practitioners to ensure that we advance the knowledge.
Yes, ladies and gentlemen, let's make welcome Honorable Minister for Education, Honorable Dr. Tanko Yusuf Sununu, for his goodwill message.
I want to thank you very much and to also tell you that I'm ready to work with you to see how we can provide an enabling laws or acts that can fast-track our development, can protect us, and also can protect the right of those who submitted themselves to our care.
The theme of this conference, which is very apt, collaboration for assisted reproductive technology, global best practices in Nigeria. I think this is in synergy with the vision of the Ministry, Federal Ministry of Health, ably led by Professor Mohammed Ali Pate.
It's been a great conference, well attended as usual. All AFRH's conferences are usually well attended, over 300 participants. The good one, the hall is full, so it gives presenters, speakers some joy to talk to a full hall. 3D today is the gold standard for the diagnosis of congenital uterine anomaly. Not hysteroscopy, not laparoscopy, not MRI. At least we've been able to bring in some new insights to how to make the diagnosis, new insights on whether to operate or not to operate, new insights on what type of tool to use for the surgery. So these are things that people who came to this conference are going to leave this conference with.
If you're doing your ART, that site has to be prepared.
There's a reason we have our LH as HCG-driven bioactivity.
Of course, those researches basically were done in the UK and the US.
If AFRH has a registry of the results you are having, anyone can analyze that data and come on this stage and present it.
Are you willing to sponsor about 10 to 20 clinics to carry out research so that we can have our own publication and comparisons for all these products?
You have to prove that studies that have been published elsewhere are generalizable to our own patients here.
So what I've just presented to you regarding France and Germany are not studies, sir. Those are not clinical trials. Those are real-world evidence which is based on the practice that you are having.
Women get to an age and the only gospel they are preached to them, when are you going to get married? So in order to prevent this, then you can do elective egg freezing.
The second take-home message is, can we really be assured and sleep well knowing that 70% of pregnancies in Africa after ART are lost to follow-up?
A child that is born to surrogacy in Nigeria, is that child a Nigerian if the parents are from the UK?
A word of warning when you're doing lab designs: if you buy, for example, a 1200mm workstation, that is the size of the working area.
What's important is, just like we say fibroids are so common amongst us, adenomyosis rather than pelvic endometriosis is the African problem.
Why don't we want litigation in Nigeria? Litigation is adversarial. Winner takes all. You love that everybody consolidates in their positions and locks horns. That's not where you want to be in a fertility dispute. ADR is the better way to go.
A round of applause, please. Ladies and gentlemen, for the first traditional dance, let's make welcome the King's Theatre Company.
Don't make mistake to pay your first rent in Wuse or Metama. When it is time for you to renew it, you will see yourself in Suleja. That's how Abuja is.
Oh yeah, ọmọ pupa o, ọmọ pupa lè bí fẹ́, ọmọ pupa o, jọ̀wọ́ mo fẹ́ ra yìí. Ọmọ pupa o, ṣé ọmọ pupa lè bí fẹ́, ọmọ pupa o, jọ̀wọ́ mo fẹ́ ra. Enjoy. Come on up.
This call is an appreciation call, and I want to especially appreciate all the delegates that came from far and near. Without you, there would have been no conference. A lot more people joined online than ever before. I want to specifically thank the exhibitors. This year too, we are proud to say that we're oversubscribed in terms of exhibition.
I ain't gonna worry, I ain't gonna push, I won't push the baby. Say, come on, come on, come on, come on, come on, baby, stop being round the bush.
And we have been committed to hosting a major international conference with the AFRH, which is the world body, and the African Fertility Society. And that's going to be a major conference here in Abuja in 2 years' time. And with that sort of thing on your plate, you don't start changing leadership. Otherwise, you will let yourself down. So the trustees, in their wisdom, advised the general meeting that the executive that had done so much should stay for another 2 years. So the question was put to the House, and the ayes had it. They are therefore sworn in at the executive committee of the AFRH for the year 2024 to 2026. So help you God.
Amen. Thank you very much. Thank you very much. Thank you very much.